Well, I want to get started talking about your health journey. You have a pretty remarkable story. You were a young doctor. You were kind of maybe, I think, starting out in your career. I believe you were working in emergency. You can correct me if I'm wrong, but you started to experience a series of symptoms that led you down a healing journey. Can you take us back to that time in your life where you started to feel maybe some physical symptoms that you couldn't pinpoint exactly what was going on and what was happening at that time?
Absolutely. I was a few years out of my residency training, so I was a young doctor. I was a young mother at the time, and I was working in a county hospital serving underserved patients, particularly in HIV work. I felt like I was really at the top of my, sort of at the top of my game, in terms of, I just completed this really rigorous training. I was feeling really good. I had all the data, the latest data. And my husband and I had this, beautiful little girl. So it was right around that time. My specialty is internal medicine. And I was a specialist, quote unquote, in chronic diseases. And also, internal medicine is the field of what in the back in the older days, people used to call us the sort of the prime diagnosticians. So we were really trained to look at the whole body, in terms of systems and then making a diagnosis. So we were sort of, the problem solvers, the detectives, which is really what drew me to that particular field. Each field has its own kind of personality, and of course, and I loved working with patients, adult patients, with living with chronic conditions, and how do we make them feel better. So it was right around that time that I started having a lot of symptoms that I didn't really understand, but I was also a new mother. So, you go through pregnancy, you go also, I mean, before that, go through residency. And so it was just sort of like, your body is tired. You're having all sorts of symptoms. You're also challenging your body in a way that you've never challenged before. And so I didn't even know that there was anything wrong. I didn't feel comfortable. I was having a lot of trouble sleeping, um, a lot of um, a lot of weight loss, actually, really rapid weight loss. Hair falling out, palpitations, dizziness, fatigue, and so one of the less favorable attributes of my training is that you just kind of learn to suppress your symptoms, mind over matter, really just ride through it, power through it. It will improve over time. So I applied all of that to the symptoms I was having. And again, like it's hard to actually know what's normal. And what I love about what you guys are doing right now is really engaging, an audience that is kind of in this demographic, right? Generally, like kind of young adults beginning sort of this new stage of life. And there's so many unknowns. There's just so many things that we have to live into through experience. And so one of the things that we've done as a culture is we've kind of normalized not feeling well. And so it is. So it's like, oh, when I wasn't feeling well, I was talking to young mothers, I was talking to other doctors. I was also talking to specialists, right, to mentors in my field. And they would all say, oh, yeah, yeah, it's normal. And so I realized in hindsight, I was probably comparing myself to a lot of people who weren't well, but then kind of normalizing unwellness and just deal with it. Things will get better. And they didn't actually, they continued to get worse.
Yeah, I think I can relate to so much of what you're saying, especially it's funny when you're pregnant, any symptom is related to pregnancy, right? So anything that you feel, they say, oh, it's probably just because you're pregnant. Oh, you're feeling this. Oh, your teeth, your bleeding gums, this, and that. So you kind of just like, okay, it's just because I'm pregnant. And then after I had my baby, I still wasn't feeling great. And it's like, oh, it's just postpartum. But you can kind of see like how that can all build up over time and compound, and then it's like you just ignore it. Oh, it's just this, it's just this, it's become I'm a mom, I'm a young mom, I'm not getting sleep, and then it's like, at what point does it become alarming? So I kind of want to still walk through your journey.
Absolutely. Yeah. And, and just even beyond that, it's so part of the challenge that I have now lived through and been able to see, not just through my own journey, but in working with patients now for 10 years in functional and integrative medicine, is that part of the issue is the diagnosis can be really, um, it can be really validating for people, and sometimes a relief, like, oh my God, there's a name for this. And, and maybe there's medication for this, and maybe there's even diet, right, and kind of exercise, and there's a whole protocol that we can follow. um, but the diagnosis can also just be something that we use to just normalize it. So like PMS, right? I mean, premenstrual, cramps and bloating and breast tenderness. I mean, all of these symptoms of hormonal imbalances, we've kind of, oh, well, it's just PMS. Oh, well, you're just on your cycle. And it's like, well, but actually it doesn't need to be that way. And it also means that things are out of balance. So how do we begin to listen to that, tune into that as imbalances, tune into ourselves with a little bit more patience and compassion, and begin to kind of reframe how it is that we approach even diagnoses and names. Yeah. Yeah, so my journey, so I was still fully functional. So, that's often what we gauge how well we are by, is how functional are you and how much can you do? And so I was still really functional. I was highly functional with, hardly any sleep, nursing a baby, working, traveling, having a very active husband. So, life still was very full. And then I had, I guess, I mostly got better. I ended up getting diagnosed with postpartum thyroiditis, which is a postpartum form of Hashimoto's or autoimmune thyroiditis. So I was overactive thyroid, then underactive thyroid. And I sought out, the top-notch specialist at a major medical center here. I'm in, the Bay Area in California, where there's really, really wonderful medical care. So I took medications, and unlike most forms of Hashimoto's, the postpartum form tends to resolve. So after a year, sure enough, I was able to taper off my Synthroid, my levothyroxine, and then, I was deemed sort of, in remission or cured, but my symptoms actually were largely the same. So a couple of years, then another year later, so this is 2 years after I became a new mom, I got pregnant the second time, and it was this very dramatic episode when I was in Beijing on a trip, and I didn't know I was pregnant at the time, but I lost consciousness at one point, and had woken up in an emergency room there, and I learned that I was newly pregnant, and that I didn't know this, of course, in hindsight, but I had really, really severe vertigo, disequilibrium, uh, really severe fatigue, all of these symptoms that would become the beginning of, a decade long journey through. So the autoimmune thyroiditis recurred, chronic fatigue syndrome, dysautonomia. A lot of what we're seeing now, actually, as long COVID, as post-COVID syndrome, there's a lot of overlaps with chronic fatigue syndrome and dysautonomia. So that was the beginning. Yeah.
When you were taking Synthroid, you were taking your thyroid medications, and then you were in remission. Does that mean that your numbers look normal, but you were saying your symptoms were still there?
Yes. So my antibodies yeah, they normalized. My thyroid numbers looked normal. And even, some of my symptom, like my heart rate, my resting heart rate was normal, or within the normal range. I'll put it that way. Everything was within the normal range. So, yeah, that's what I mean. Yeah.
Yeah. You know, what I find so interesting about your story, and it breaks my heart to hear what you're going through, but you mentioned this earlier where, when you're high functioning, so many of the women who are listening to this podcast are high functioning, ambitious women, and you don't have that connection to your body of what feels right, because like you said, we've really normalized it. And I just think your story is so interesting because you are this doctor, you are the expert in what you're dealing with, and you can't even find the answers for yourself. So I'm curious, you have been going through a decade of these unknown symptoms despite trying and feeling like, okay, I'm functioning, I'm still taking care of my daughters, I'm still working. What was maybe the first thing that you did? Because I think you mentioned in another interview, going back to the basics was super critical. So maybe you can kind of paint a picture of maybe that first step you took after you realized, gosh, I've gone the conventional route. I've tried all these things, but I'm still feeling not like myself.
Yeah, I mean, one of the things that's been, yeah, illuminating for me is, people will say, well, you're really blessed because you're a doctor. And so you can kind of, navigate your way through this. And I said, well, it's kind of a double-edged sword because it also took me that much longer to even, I mean, it just sounds ludicrous when I look at it in hindsight, but I was such a believer in my paradigm as truth, not just, oh, this is medicine, but this is life. I mean, I really saw life this way, black and white, and you can control the variables as long as you can identify them. And it took me a very long time. I mean, I was really, really crashing and kind of hit multiple dead ends, and not just with my health, but with my life. My marriage was totally stressed. We were really at the breaking point. I couldn't manage my kids. I mean, I was really largely housebound at this point, and so it was at that. Sometimes you have to really, really fall in order to break open. And so it was out of desperation that I began to try differently. Now, the first thing, functional medicine at that time is not. It's still, not kind of not close to mainstream. I know that in the Bay Area and in California in general, it's a lot more accessible and people know about it a lot more. But even at that time, this was, 10, actually, this was 15 years ago. I hadn't even heard of functional medicine, and integrative medicine was quite new. Um, and what I ended up doing was going back to basics with my medical training, and I went to my textbooks. So I kind of went way beyond sort of the diagnoses, the treatments, the protocols, and really into the mechanisms of disease. How do chronic diseases begin, and what does health even mean? And actually, a lot of it was in our textbooks, but then kind of glossed over. And then once we got into clinical training, it was it was really focused on patient care and protocols and drugs and procedures and things like that. So I began to realize, oh, you know what? Actually, chronic disease it's not a you either have it or you don't. It's a chronic progression, and that often these imbalances are beginning, years, if not a decade or more, before you actually get the diagnosis. And so, and I began to piece things together. Oh yeah, actually, I wasn't feeling well even in residency. Oh, and I had these symptoms during my pregnancy, or I had these symptoms before. And oh yeah, God, I forgot. I had a lot of trouble sleeping, when I was in medical training, things like that. So, okay, so there's been a lot of imbalances going on. And then the pregnancy was the tipping point, right? And also we had no family history of autoimmune conditions or thyroid conditions. So, the whole notion of genetic predisposition wasn't even there as well. I don't know if it would have changed anything, because the way that we've been trained, there's not much you can do, right? Like you either get it or you don't, and you have an increased risk. So there's not a lot in terms of educating, ourselves about how do you reduce the risk? How do you actually reduce inflammation? How do you reduce the stress response, in your body? All of which can really contribute to the turning on of autoimmunity. How do you give yourself your immune system things that support healthy function so it doesn't dysfunction. How do you heal your gut? And what is the relationship of the gut to autoimmunity? So all of those things, were completely not on my radar. So I began with Pathology 101 and then began kind of piecing things together. So first was like, okay, I need to get more sleep, because if I can't sleep, how do I get more energy? And so I had already been doing all the sleep hygiene things, because I'd been having sleep challenges for a while. And then I went a little bit deeper. I was like, okay, there's the circadian rhythm. Actually, what I do during the day also impacts what I do at night. What happens at night? How do I begin to, and I would say, the biggest initial aha was like, oh, my body is an ecosystem. I'm part of nature. Like I need to align myself and recognize that things are constantly changing and moving and dynamic. It's not like a fixed protocol that I need to give myself. And so that even is also, I think, one of the challenges of clinical medicine and working with patients, right? Is like oftentimes we'll find something, like we'll find the diet that is really useful. Like in the very beginning, when I changed diet was one of the earlier things I changed as well. And I began researching the links between certain foods and triggering specifically autoimmune thyroiditis, namely dairy and gluten. And so eliminating that actually helped considerably. To this day, I'm still gluten and dairy free, but then I initially did this like 30-day paleo reset. Back then, I don't even think autoimmune paleo and any of the other diets that are out there now were kind of existed. So it was kind of just piecing things together. And to stay on a really, really restricted diet for a long time also doesn't work, because again, our guts, our bodies, we're ecosystems. And what we really need is we need variety. We need to constantly stay attuned to, it's like changing seasons. Like, do we fertilize the ground do we fertilize our plants, or our vegetables? We have vegetable boxes outside in the winter. It's different than how we approach the garden in the summer and in the spring. And so it's just like, oh God, there's a constant change and we need to keep, modifying. And I think that's one of the challenges of clinical medicine and even just us being, living our lives as, whether we have a health condition or not. It's like, oh, we have to constantly change and be attuned to that and be flexible to it, which is really where resilience comes in.
Absolutely. I think that what so many people resonated with when it came to your story, especially your conversation with Mark Hyman, which I think I told you was like one of our most popular conversations that we've ever had on that podcast, is that here are two physicians who studied traditional medical training. They went to medical school, they did everything, they were young residents, and they both got sick. And unfortunately, Mark always makes a joke like, I keep going through these things so I can find out how to heal myself and teach other people, which is like, nobody wants that. I don't wish that upon anyone. But, here's two doctors kind of saying like, we had to also go through these things too. We had to discover like there's an entire wellness wheel and you have to hit all the spokes of the wheel. You can't just throw a medication at it. You can't just change the diet. You can't just change the sleep. There's all these things that come together to create health. And you mentioned the diet. I think you talked about ancestral diet or Weston Price and all of these different things that you've done. But one of the things that was the most interesting part of that conversation that you brought up was this idea of energy healing. And that initially, this was something that you might have been closed off to, or just thought like, what is this? This like, I didn't learn about this. This makes no sense. It's just woo woo. And it was a really interesting story. I'd love for you to share it, that how you got introduced to this idea of energy healing and the role that it had in your journey.
Yeah. And yeah, absolutely. So I would say there were two entry points for me. One was that when I was really desperate, I ended up seeing an acupuncturist, and I tried several. I was like, kind of like, okay, well, I'll try one more, that's it. And that's also where I learned, like, it's a lot of times with these healing modalities, and even with functional medicine, right, or with a primary care doctor, so a lot of it doesn't even depend on, it's not so much skill as it is like resonance. Like, what is the fit between the patient and the doctor, or the patient and the healthcare practitioner? Because it's like any other relationship, it's like your partner or a child, or like you kind of need to feel into what feels resonant, and go with that. And again, because we change all the time, like somebody that I adored and really helped me, either as a teacher or as a practitioner 10 years ago, may not resonate anymore in terms of a fit. Like they can still be beloved in my life, but he or she has changed and I have changed, and we might not actually be a great fit in terms of how it used to be. So that is something that I've learned. And so my acupuncturist was the first time that I had experienced energy healing, and he was the first one that introduced me to the notion of they're working at the energy level, to rebalance my body, to help me attune to patterns that were more healing rather than inflammatory. And then the second entry point was that when I will say my acupuncturist and herbs, I also took herbs as well. And then he kept introducing me to practice Qigong, which is it's a mind body practice that he said, oh, if you do it, it can help you kind of between the sessions, kind of help maintain energy between the sessions. And it wasn't my thing. I also felt like I was doing so many other things to support my health. So the second entry point was that by the time I felt well enough, and then I had learned by that point, this is years later, I had learned about functional medicine as a paradigm of basically what I had been piecing together. And I went to a functional medicine conference and suddenly had infinite amounts I went from kind of very few options of what to try to kind of an infinite number. And then a lot of the protocols that I had learned they didn't quite resonate for me, or they were too strong, or there was too much. And, my system was really sensitive. So then I realized that I needed to learn how to, again, attune to what my body needs right now. And that's when I learned how to develop my intuition, and specifically medical intuition, like applying it to diet, to supplements, to medications.
Cynthia, I love this because tapping into your intuition, you don't hear a lot of doctors say. And even if you don't have a medical condition, it's so important in life just to like be in tune with what you're feeling. And like you said, every day you could feel a little bit different. But going back to you really tapping into it for your own chronic disease and everything you were going with, what advice, how did you really develop that? Because for so long, we're trained not to listen to our bodies, right? And that's just our MO. So how did you really tap into that? And what advice do you have for people when it comes to really building that intuition with themselves?
So I think the hardest thing about intuition is that it's hard to decipher what the signals are, because fear can be a really, really big signal, right? And it can actually obscure what the true signal is. So the hardest part about tapping into intuition is to silence the mind, and also to release the fear. So it's truly just to learn to observe, which is basically learning how to sit in meditation, how to sit with no mind. You clear the mind, you clear your thinking mind. And if you can't clear your thinking mind, you learn to observe your thoughts. I mean, that's the hardest thing, and most of, and I, being, being very accustomed and trusting my thinking mind, I really just wanted to know, like, how do I do it? And it's like, oh, the way to do it is first to learn how to just be still and stop doing, like, don't do it. And so I will. And then I had two intuitive healing mentors who really began to guide me and how to teach. So one of them, I would say, taught me a little bit more about how to meditate, how to be still. And then the other one was highly attuned as a medical intuitive. So she actually taught me sort of how to use intuition and apply it to clinical medicine, or to apply it to myself. So some other tricks, though, because it's hard, it's a long practice for most of us to learn how to silence our minds. So while we're doing that, so first, relaxation is really an entry point. So any of the guided meditations, people can find it on apps like Calm or Insight Timer, they're available, and YouTube, anywhere. You can play something, or music, but relaxation is the first, like, it's just the door, right? So we have to be relaxed. And then another thing is that, because the thinking mind gets a bad rap a lot of times when we start talking about meditation or like clearing the mind or intuition, but really all the thinking mind wants to do is to solve things. So one of the tricks is what I learned actually through a grief therapist when I was doing a grief ritual to really detox, my emotions and the soul, is timed automatic writings. And so literally you can set a timer for 10 minutes, and you can choose a prompt. But it's something kind of generally wide open, but that can guide you. So like, I remember when ... could be a prompt, right? Or my tears ... And so you set the timer, you've got a pen and paper, and it's important to actually write, right, as opposed to type. And you're writing, and you're supposed to just keep writing. You cannot stop, you cannot pause, you cannot cross through, go back, edit. And if nothing comes up, you just write, nothing is coming up, or my mind is blank, I have no idea what the heck I'm doing, but you're just writing. And it's a way that we train our thinking minds to actually, our minds, we can't keep up, right, with the automatic timed writing. And so you just begin this practice fluidly. And maybe the first 5-6 times you do it, it's totally nothing. But a lot of times stuff comes up. And it's a beautiful practice to actually do with a partner, where you just agree to totally keep it in confidence. You then read it with each other, and no comments, no questions, the other person's just a blank observer. And so again, we also learn to observe someone else and their thoughts and their emotions, to quiet our questions, to simply observe. So there's also a meditative practice in that, right? And just receiving and generously listening without judgment, without labeling. And so there's a lot of techniques like that to begin to tune in. A dream journal is another one. So dreams are where our subconscious begins to arise. And, just like you were saying about Mark Hyman saying, oh, he needs to go through these things in order to teach, is like, well, really healing is about living and experiencing in abundance, right? That's really all healing is. It's coming into balance and experiencing an abundance. So the dream life is really simply our consciousness, subconsciousness, our consciousness, either processing or showing us, I don't know, messages or whatever it is that we're experiencing on the subconscious level that we might not register. And so the more we can write those down, not get attached to necessarily what they mean, but kind of sit with the experience, We can refer to them afterwards, maybe in hindsight, like, wait a minute, God, I just remembered something, that triggered, that experience in life triggered something that I dreamt last week. You go back to your dream journal, and then you can begin to maybe piece together and learn, like, oh, what feels like intuition and what feels like, just the mind processing its stuff. So yeah, a lot of these are just going to be practices.
Yeah, I love, and Cynthia, I'm chuckling here because I've been having crazy dreams, not crazy, active dreams like the past week consistently. So you said, because so many of us have dreams and we're like, that makes no sense. Like I was in a carnival, like on rides with a nice dress and heels, and I was like fine in the carnival. And at the time I'm like, okay, what the heck does this mean? I had that, dream last night. It's so random. But you're saying even if it doesn't make sense, still write in the journal, and maybe there might be something that comes from it, but like don't overanalyze maybe your dreams. If it doesn't make sense at the time, you still recommend putting it down.
Absolutely, because one of the things with intuition, and one of the things with functional medicine, and actually in conventional medicine, like the wisdom is actually not just in looking at the specific numbers and like what's the data, but is like beginning to observe the patterns, right? So like even if the numbers don't quite fit, you're like, you know what, the pattern fits with thyroiditis, or the pattern fits with hormone axis dysfunction. There's a lot of things that we can't even measure, right? So the pattern. And so in dreams, you'll begin to see patterns, you know? And so like, I'm like, oh, okay, I know when I dream, that, okay, when there's an elevator, it has something to do with the mind, body, spirit sort of alignment. And, I go up and then I go down, so you'll begin to see patterns. And then what I love about dreams, and I've been keeping a really active dream journal for years now, is they're really playful too. Like it's really funny to see how the mind, and the mind meaning consciousness and subconsciousness, begin to process information and to show it to us. And it's funny that the subconscious is really playful, so that I love that you're dreaming about a carnival and you're like all decked out. There's something really playful in that, and then, and again, sometimes there's no meaning, behind things, but the patterns are very, very revealing to us. So again, it's just about like, what does that mean to you? Like I might be able to see some meaning in that, and just, oh, there's some patterns or whatever. And so my intuition teachers really helped me with that. But ultimately it's like, what does that mean to you? Because it's your mind showing you something, or your body, right? People will say like intuition is really in the gut. It's in the heart, these signals that are coming to us. So what is it that your body's showing you? And so even in my own healing journey, this is years later, after many years of skepticism and kind of breaking through some of my own limitations, is I would have dreams. I had this dream. I just kept having these current dreams of like swimming in a bog, and swimming in kind of slime, and it was not comfortable. And after a while, I was like, wait a minute, and as I was doing my functional medicine training, I'm like, wait, does this mean that I have some detoxing to do? And I began to look into stealth infections, and how do I detox? Oh, maybe I need to do a lemon juice cleanse, and kind of clean out, my liver, and that's what led me to the grief ritual. I need to maybe do a detox of my emotions, and again, like, not that these things are bad, that they're all just parts of life, right? It's like saying like poop is bad, it's like, no, 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 we need to detox, we need to let go. But and how do we do that? We just haven't really been taught how to do that with our bodies and with our minds.
It's interesting what you're saying about dreams in particular, because I was talking with a friend the other day that I feel like I'm having a lot of dreams where I'm having really argumentative conversations with people. I'm having like very difficult conversations. And what came up for us was this idea of people pleasing and boundaries in my life, and like not setting boundaries or not having difficult conversations, and then they get played out through my dreams, right? So my subconscious is almost like handling it for me. So it's really interesting.
Mm-hmm.
I think about dreams quite a bit, but one of the things that I think Yasmin and I talk about quite a bit, and it's actually perfect to have you on for this conversation, is autoimmune conditions specifically for women. It seems as though women struggle with autoimmune conditions more than men, and that there is a sort of energetic component to this. Why are women struggling with this thing that some people say is like the body is attacking itself? Other people have a different explanation. Have you seen this in your world, that women are struggling more, and why do you think that is?
Oh yeah, absolutely. I mean, I have seen it, and I mean, obviously, I've experienced it. But even in my family, if we look at my family in terms of autoimmunity too, um, and and also the statistics show it. I mean, it's a little bit varied from specific autoimmune condition to the other, but it's somewhere on the order total of like 1 to 6, 1 to 8. Like it's many more times more prevalent in women. And I mean, there are a lot of theories about that. The primary one being about just the way that the hormone system is so much more complex in women. We've got so many more moving parts, and something about the way that the immune system needs to be able to uh, modulate. For example, like to when we're pregnant, to not recognize the fetus as something as foreign, right? And then attack it, as like a bacteria or a pathogen. I mean, we have tons of bacteria within us, but like a pathogenic, a disease causing bacteria. And so there's a lot more, again, subtlety and complexity in the hormone system of women, which makes us, yes, more predisposed to autoimmunity, but also gives us the capacity for more resilience. Because resilience, and this is something that I really learned and parsed out in my journey, is toughness. We're taught a lot about toughness, and even like with the COVID-19 pandemic, the focus is on the outer. How do we protect ourselves, right? How do we put up boundaries? How do we sanitize, masks and whatnot? But and that's totally a part of what we need to do in terms of protection. But with that comes, again, kind of this conditioned pattern of fear, right? There's a fear because we need to protect ourselves from something. And so first off is that actually contributes significantly, right, to immune dysfunction, to stress, to all the systems being, worn out. The second thing is that then there's an internal strength. There's a resilience. So the toughness is what I call an outer rigidity, and then the resilience is an inner flexibility. So because we have multiple moving parts, we have these menstrual cycles, that men don't go through. They have a much more steadier hormonal system in terms of flux, even week by week. And so with that movement, though, we actually have more resilience, right? Kind of just genetically built in. So how do we actually begin to harness that as a strength? Because I think, usually when we hear the words like sensitivity or, subtlety, we associate it with being vulnerable and weak. But there's a different kind of strength that we can tap into with that. We just need to learn actually how to harness that and how to develop it. And so much of it is actually, how do we live in flow? That's a really big, generalized question, but that really is, for me, that's the root question. Below nutrition, what do I eat? Below that is like, well, yeah, how do you eat? How do you move? Not what are you doing with your movement, but how are you doing it? So there's something about the female system that is very relational. So it's a relationship between you and your food. It's a relationship between you and your body, a relationship between how you're moving, and literally even like, how are you taking that vitamin? And so part of my journey, which actually had happened just as my memoir was finishing, but it hadn't not enough time had passed for me to actually understand what was happening, was that I had a second health crisis. And so this was about 10 years into my journey, where I was back to functional, but I was living a highly managed life, right? So I was functional, not totally feeling well, but functional and living a very managed life. Like I was really strict about everything. And this is where that whole toughness, rigidity thing comes in. So the second crisis, I realized like, oh, there's a lot actually I haven't learned. And it's more about the inner connection, the inner relationship. And and it was very different than the first one because I was already at the forefront of internal medicine, functional medicine, integrative medicine, intuitive healing, and I was still there, right? So there was a lot more fear that I was confronting, but also like, oh my God, can I even do it again? Can I do this again? Like, I don't. And so it was an act of surrender, like real surrender. And by that point, I had already been practicing Qigong. So we didn't actually talk about that before.
Yeah, I'd love to talk about that for
yeah.
people who don't know what Qigong is.
So Qigong, Qi means energy or vitality, and Gong means cultivation. So how do we learn to cultivate that within our bodies? And what I hadn't realized, when my acupuncturist recommended it to me was, again, I was thinking much more transactionally, like cause and effect. If I do that, I might get this. But really what it is, it's self-empowerment, And so one of the challenges, even in working with functional medicine doctors or whatever, holistic healers, is that there's still an externalization of wisdom. There's still an externalization of like support. So even with that, if we're not developing our own connection with ourselves and trusting our intuition, learning to trust our own innate wisdom and our body to heal, there's this very, very, even if it's very deep subconscious fear, because we're dependent on something that's external to us. So there's this, I know for me, there was like this, want to control. Like I need to make sure I need to line up all, my people and all my meds and my supplements or whatever, and just follow all of that. So there was this management of my life, to a very, very beautiful, intricate level. And then I had this crisis. So I felt like, whoa, there's a lot I actually needed to learn about surrender and going beyond my physical body down into the energy that I am. And so, initially it sounded a little bit abstract to me. I'm like, energy healing, beyond woo woo, like what in the heck is it, And the second health crisis after that, actually, I experienced a radical remission. And so I was still, doing, I was still doing my diet. I was doing some detoxes. I was addressing some chronic tick-borne infections. So I was still doing things, but it was, again, more this relationship with myself. And so when I experienced the radical remission, I was like, oh no, I mean, there's actually something here. There's something very tangible here. It's not something that's really far out. And so kind of in a nutshell is that the way that I had approached my body healing and also working with patients was very much still, even if it was a much broader context, was still within the physical realm, was within the Newtonian physics, mechanical physics, biomechanics. And then there's this, again, kind of functional medicine being root cause medicine. Like I was like, oh, there's a deeper root below that, which is energy. And the expressed way of that is how do I relate? How do I stay in flow? How do I continue movement? How do I not get attached to even the idea of being healthy? Because that becomes its own block. And because it fuels fear, right? It doesn't allow my body to be in flow. And then now, continuing on that journey, below energy is actually information. right? Which comes circular to a lot of what we talk about in holistic and, integrative functional medicine, is like food as information, chemicals as information, relationships as information, all the inputs, but really starting with the inputs of our minds, you know. And so, the two really, really big factors are food, just because we're eating all the time, and then thoughts. So thoughts, a lot of the neuroscientists, they actually debate how to actually measure a thought physiologically with the devices that are available. So depending on how a thought is defined by measuring, it's estimated anywhere from 6,000 to 80,000 thoughts a day, right? So we constantly have these inputs, and our bodies they're just agnostic. I say they, it's actually we, right? We are our bodies and we talk about them as separate, but no, we are our bodies, but they're responding to just information, And so how do we begin to consciously connect with what it is that, that I'm feeding my body? So I'm not just feeding my body food, I'm feeding my body thoughts and information, right? And so if we are constantly doing social media and news bits and, tabloids and whatnot, especially right now, the rapidity, how fast information is, and all the challenges in the world, it's a lot of thoughts that are programming the way our cells are operating, right? So there's a way, that with our minds and with this, and I'll go into Qigong practice, but that we can begin to not only choose what kind of information we're connecting to, but we can choose the way that we relate to the relationship. We can relate to the information that we're receiving, right? So there's data on trauma, right? So if we look at an event that happens, why some people develop PTSD, post-traumatic stress disorder, and some people don't. And it has to do with their relationship, how they perceive that event, right? And so, yeah, we can go into systems like, okay, there are certain genetic predispositions, there are certain, is your stress axis, how resilient is your stress axis before you go into that experience? There's a lot physiologically that, we can boost resilience, but a lot of it is also the perception. How do we perceive what's happening? And so for me, having a really sensitive constitution and and a lot of what is perpetuating autoimmunity and inflammation as a whole is this kind of, it's like a micro PTSD state every day, right? And we know that there's this loop that happens, and so in our minds. And so with autoimmunity, there was just a lot of fear. It's like, what if I eat that? What if I do that? What if I exercise too much? Am I going to get another flare? Am I going to get a setback? So for me, the practice was Qigong, was this cultivating energy, cultivating vitality. And again, I started with it really pragmatically, like I'm going to start 15, 20 minutes a day, something I can work into my schedule. And I just saw it as a way to rehabilitate my neurology, my hormones, like things I couldn't physically, I couldn't go to the gym and work out, but like, I can work out my internal workings and bring some order to them. So again, giving them information on how to operate, right? So there's a lot of different ways now. There's neural retraining programs. There are heart math is a little biofeedback device that I love. I don't know if you guys have explored that on your show, but you plug it in, or you have an app, and you can literally learn how to breathe in a way that brings you into coherence. And coherence is different than relaxation. Relaxation is a part of coherence, but relaxation tends to be a low energy state. So nothing wrong with relaxation and comfort. In fact, we, really want to be comfortable and relaxed. It's low energy though. And so there's not a lot of healing that happens in that state. But there's not a lot of trauma either, right? There's not a lot of inflammation. So coherence is this state of flow. And so it's active, it's healing, it's relaxed. So heart math is a biofeedback mechanism that anybody can do, from their home. So and then for me, I played around with heart math. I played around with neural retraining. They were all, again, wonderful entry points for me, but not something that just really drew me in as a practice, as a lifelong practice. And Qigong is based in, 3,000 years at least of practice originating in ancient China. So it's a mind-body practice, and it's helped me to perceive the body in a way that is beyond the physical, that is beyond the flesh, and that's the place where quantum healing happens. That's why it's called quantum leaps or radical remissions, right? So they're not miracles. They're actually really ordinary, but it's not the normal, right? Then we actually call it something really radical. It took me, my own experience though, to really appreciate how ordinary it was, because a lot of people hear about those things. And I've even seen it in my Qigong communities, where people have these radical healings that I can't even explain medically. But I've seen enough of it. Radical actually comes from the Latin radix, which means root, right? So it's actually like going to the root of something, but it can also mean like something really drastic. So radical healings can either be, we think of spontaneous healings, but again, those are kind of like, the people who have like a tumor and then suddenly they don't have a tumor. For me, it was not that. And for more of the people that I've known who've gone through this, it's a little bit more of a really rapid healing that, again, defies kind of the standard data that we have, right? Sort of the standard trajectory of healing. So whereas it took me a decade before to kind of get to where I was, which is already in itself kind of a radical healing, because it didn't follow the prognoses, right? The probabilities of people with chronic fatigue syndrome or dysautonomia healing to that level is already really, really low. But in this case, my healing happened over a few months, which blew my mind. I was like, wait, what in the heck is happening? And whoa, there's something now that I can recognize, like, that I can do this, instead of just saying, oh, it doesn't happen to me, it happens to those other people, and it's really rare. I was like, this is so ordinary. And it's because I had been practicing Qigong for a long time. At that place, I just began accessing energy in a way that I hadn't before, because I had nothing else to go on. It's just like, okay, just surrender to it and just practice. And I was practicing a lot more than I was, before, as a rehab exercise. So yeah, so it's so a lot of what I do now is incorporate Qigong coaching into the sessions that I work with patients, and gradually, increasingly, only taking patients who are into their practice, because it's such, again, for me personally, but also from the patients that I've seen, it's such an important foundation, and it's what I know, right? So we teach both what we know, we also teach what we need to learn the most. So it's not for everyone. And a lot more people, right, are interested in a cleaner sort of functional medicine paradigm, which is great too. So yeah, and they're all available.
Right. I actually, when I was pregnant, I was experiencing a lot of fear. And just as the internet does, it identified that I was pregnant. And so I started to get a lot of information about Qigong. I started to read about it. I started to read about how pregnant women who practice it had less instances of gestational diabetes, preeclampsia, unfortunate outcomes during labor. And I just had fears around all of those things, almost irrational fears, because it was my first time being pregnant. So I actually started to practice Qigong when I was pregnant.
Mm.
And it was amazing. It was really something that was one of the only things, because during meditation my mind just it
Yeah.
wouldn't quiet the same way that it normally does
Yes.
when I was not pregnant. I was able to kind of really get into it. But
Mm.
it was really nice at that stage because it's active.
Mm-hmm.
So you're moving your whole body versus sitting and trying to quiet your mind. So I really appreciated that and loved it. And if anybody is pregnant and this is resonating with them, I highly recommend it. It was really good for me at that time.
Mm. Wonderful. Yeah, it can really support your energy. It can, um, nourish the baby. There's a lot. Yeah, a lot that it can do.
And what I love about this, and I also know people, my cousin, similar story, like she's in conventional medicine, tried everything, had a horrible condition, saw an acupuncturist, learned about Qigong. And that's when she truly felt like she saw a difference because she tried everything. But what I love about it is that you can easily Google it, right? For anyone who's listening, because when I heard about Qigong, I'm like, what is that? So where do I find it? There's so many free resources online that you can just Google YouTube and do a 5-minute one. Like you said, Cynthia, in the beginning, you just did it whenever you had time. Like there's no rigidity among how you start. So it's something that I've been fascinated about. And just hearing this conversation with you just gets me now more motivated to get into it because I believe in all this energy work. But I think it's really beautiful. So I know we talked about a lot today and we're coming up on time, but maybe at a super high level, if there's anyone who's struggling with autoimmune disease, what are 3 things that they should start considering?
Well, I think, we covered it a lot in our conversation, but the first thing is uh, connecting to your body. And I think that might be the hardest thing because by the time most people are diagnosed with autoimmune diseases, they felt like their bodies have betrayed them for a long time, or they're really uncomfortable places to be. But really, the 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 healing begins when we connect to ourselves, right, and recognize, oh, I'm not actually attacking myself. Um, I just need to learn to be compassionate with myself. I need to be in my body, right? And also just observe and learn not and to go beyond the symptoms. Like I'm not just my symptoms, right? That there's this whole other being that is beyond that. Um, Something more practical is food. Is we have to change our diet, and it's for a long time I thought, oh God, I got to do it. Because I have to, kind of thing. And quite honestly, right now I don't have to be strictly gluten and dairy free, but I choose to, and I don't really think twice about it anymore. But I like how I feel, and so it's, again, just, and there are a lot of, again, just like with Qigong, there's entry points at the body level. You can do it, start as an exercise for 5 minutes. There's the connection starting point at energy level. And then for some people who've been practicing meditation maybe for a long time, or they're just wired that way, you can start at the consciousness level. And all of them, work in concert. Same thing with food, right? You can really start at the prescriptive level and just say, and I would say, in general, a paleo diet would be a great way to start. If that feels hard, a gluten and dairy free whole foods diet, like just eliminating prepackaged foods, would be a great start. So really, everyone has their own starting point, and whatever feels doable. Um, and yeah, the third thing is I would say move the body, because again, as part of information, if we stop moving um, the body receives information that it's not as necessary, right? So moving the body, and that's again where qigong and practices like yoga can be really useful because they're so gentle. So starting gentle, because movement can be uncomfortable for a lot of people with autoimmunity. And then some of these practices with Qigong and other modalities can be done sitting down, and even visualizing, right? There's data now that if you visualize movements, that it has similar changes, both in the like the mitochondria, the way that the brain is activating, and so there's benefits even in visualizing. So, but really learning how to inhabit the body fully.
So beautiful. And Cynthia, I love just, this whole interview is you just really emphasizing, especially as women like us, to really be in the flow, understand our bodies, really build that connection. And, even if you don't have an autoimmune disease, I still think it's so critical because you want to prevent that. And it's something that I think about quite a lot, especially as someone who has been, in stressful work situations for a decade, and I'm still unwinding all of that and honoring my body. So this was so beautiful. And, we want to end, we do this fun question at the end of our interviews, where we ask, it could be playful, it could be not playful, however way you want to take it. But what are maybe 3 things as a physician that you would never do to your body?
You mean now? Because
Yeah, now that you know all this.
because I put my body through the ringer, so I kind of learned. I guess I learned the hard way. 3 things. I mean, that's a tough.
Well, definitely no dairy, gluten. We know that.
Yeah, I mean, I guess that it's what I shared in terms of um, wisdom for people with autoimmune disease is, yeah, like um, I would never sacrifice my body for anything. Um, and I do feel like this mindset of like being a martyr, even in the name of service for other people, is it's a big cultural message, um, a lot for women as caretakers as well, but we can only take care of others, when we take care of ourselves. And what I love about like the energy healing and the neuroscience where they meet is that there's data on that now, right? Like when we come into coherence, there's this state of coherence that I spoke about earlier, we can bring other people that are in our field into coherence. They don't even know what's going on. We bring them into coherence. And so if I'm a doctor and there's a patient in my field, or I'm, at the dinner table and my kids and my husband are in my field, like if I can stay in that place of coherence, even when there's like stuff going on that could be triggering, I can help bring them into that state so that they can become more empowered to make clearer, more conscious choices for themselves. So it's this huge invisible superpower, that's very tangible. So I think that's the main thing, because it encompasses so much, right? I mean, it can apply to anything in our lives, and it also gives me permission to play, right? Really to play, and pleasure is another nourishment I think that we're starving for, um, particularly as women, and in the health sector as well, is, oh, how do we play? And it's very, very important. And so playing with movement, playing in nature, integrating all of those pieces so that we're not even thinking about it as prescriptive, but really, again, kind of going back to a theme earlier, is living is really, healing is really living, right, in abundance. And so how do we do that? Kaya's got a child, like how do you be a mother, but how do you play with your child? How do you learn with her, as opposed to like, how do you just take care of her, right? And like protect her. It's like, oh, what is she teaching me? And it can be really playful as well. So
And
my
that's
kids,
like the number one thing that children want from us. Like that's what they need from us.
absolutely, absolutely. And so we can guide, and my girls, I have two girls now who are teenagers, and I'll just say it's very humbling, to to raise girls nowadays, but it keeps it real. It's just like, if I feel I can feel my resistance now. So the thing with a lot of these energy practices and tuning into the self is it's so easy for me to feel my own internal blockages. Like, oh, I'm feeling resistance. I am not in flow. Reset, and then, okay, what in the heck are they trying to teach me about myself? And they just showed me where my blockages are. They just showed me where it is that I still need to learn to release and let go. And from that state, I can be a much better guide for them. So it's, yeah, it can be really playful and keeps us humble.
Amazing.
Very, very cool. And also too about the energy thing of, we can change the people around us with our state of coherence. We all see examples of that because we've seen the opposite, where you come into a situation at a dinner, or if you go to an appointment or whatever it is, that person can be in a state of whatever they are, and we can get sucked into it too. And then we can walk into the room and somebody's glowing, they're beautiful, they're vibrant, their energy is just like, that can change the atmosphere as well. So we all see examples of this, and it's just another reason and another example we can also be that to ourselves. So I love that. I feel very inspired by it. And thank you so much for joining us today. It was really wonderful to connect with you and chat with you. And yeah, I think people are going to love this interview. So thank you again.
Thank you.